Hi, everyone. I'm Mickey Sperlich. I'm a social worker, assistant professor, trauma researcher, and a former midwife. I research the effects of trauma on childbearing and early parenting, and I'm interested in the ways that we think about and address trauma in general. In this video, I'd like to discuss some basic considerations for asking about trauma that will be relevant for doing the starting assessment as part of the Survivor Moms Companion Program, or SMC for short. There are many different ways to think about and define trauma. In the Survivor Moms Companion modules, we define trauma as a horrible event or ongoing situation, like abuse, community violence, accident, war, which overwhelms a person's ability to cope with feelings of terror or helplessness and hopelessness. Mental and/or bodily responses to these events may be delayed and may last a very long time. Another way of looking at this is that trauma is really a dynamic process involving not only the trauma exposures, but also the person's specific adaptations to the trauma, as well as their individual level of both risk and protective factors, and their levels of vulnerability based on those, and also the risk and protective factors that are inherent in the communities in which they live. However we define it, it's clear that trauma is a common human experience. According to the Centers for Disease Control, 1 in 4 women and 1 in 9 men have experienced violent sexual contact, physical violence, or stalking by an intimate partner. What's more, trauma often happens at an early age. For instance, the U.S. Department of Health and Human Services studies show that in the U.S., at least 1 in 5 girls and 1 in 20 boys is a victim of childhood sexual abuse. And we know from looking at the landmark Adverse Childhood Experiences Study, or ACEs for short, that the more adversity that you have endured as a child, the more likely you are to experience poor health and behavioral health conditions in adulthood. Responses to trauma may very well be affecting the way a survivor mom makes decisions in life, including decisions that might impact her work with you. Anytime you're working with a trauma survivor, and anyone can be a trauma survivor, it's important to ask about trauma sensitively, respectfully, and most importantly, safely. Keeping that in mind, I'd like to offer the following general recommendations for asking folks about their trauma in the context of doing the SMC. First, preparation is very important. The SMC uses the ACEs screener and also screens for post-traumatic stress, dissociation, anger management, and interpersonal sensitivity. At the onset of the assessment, we explain to SMC recipients that the purpose of these questions is to help your tutor get to know you and your needs. So the first thing to do is familiarize yourself with the ACEs screen and the other measures and practice using it. Take the measure yourself and see how it feels to be asked the questions. Here's why. We've learned that SMC tutors may find it difficult to ask the survivor moms about trauma because many of us have trauma histories ourselves and may be a little hesitant to go there. Becoming familiar with the ACE screen and your own response to taking it might help you and the mom to build trust right away. Of course, trauma-informed care is not simply about providing sensitive care to others. We also get to be included in this approach. Our feelings matter too. And if we're uncomfortable because of our own trauma reactions, we deserve to have safe spaces in which to process those. This is where clinical supervision can be particularly helpful, even if we're not clinicians providing therapy. As we learn more about trauma and its effects and apply that knowledge to our own lives, it's critical that we find ways to take care of ourselves. Many of us have little opportunity for this sort of support. So part of preparing to ask others about trauma is to consider our own trauma histories first. Does this mean that providers should be doing trauma-specific work even if they are uncomfortable doing it, regardless of their history of trauma? Absolutely not. Just as survivor moms get to decide if they want to disclose their trauma, we should get to choose whether we are ready to address trauma with pregnant women and new moms. That is why we encourage self-selection rather than assignment of tutors and supervisors for the SMC program. We're also aware that providers may be concerned that they don't have the necessary knowledge or skills to ask about trauma, that the questions might be too intrusive or personal. They may also worry that the client might become very emotional, so emotional that the interviewer might not necessarily know how to respond. The good news here is that studies have shown that by and large, people do not mind being asked about their trauma. Even those who have had a lot of trauma in their lives report that they think it's a good idea for the provider to ask about it, whether or not they volunteer the information. Just the simple act of asking indicates to survivor moms that there is room in your relationship to go there. And one thing you will notice in the starting assessment is that we don't actually ever ask for specifics related to the traumatic or adverse exposure, just whether or not the person had it. That is purposeful for a couple of reasons. First, because we want a survivor to have the option of doing the SMC without ever having to disclose her trauma at all. And second, because processing trauma rather than simply disclosing it is actually outside the scope of this SMC tutor role. Having said that, some survivors will spontaneously disclose their trauma experiences, and tutors will need to be prepared for that. So one big part of preparing to ask about trauma is to make sure that you're ready to respond quickly and effectively. Every person asking about trauma should have a list of trauma-knowledgeable resources close at hand. These should be personally vetted by you, up to date, and ready to go. They should also include local therapists who specialize in trauma treatment, local domestic violence shelters and child advocacy centers, peer support options, and so on. Forms for collecting and organizing referral resources are on the SMC website. Responding to disclosures in a prepared, accepting, and compassionate way is very important, and I will cover that in another video. Being a survivor mom can be physically and emotionally vulnerable experience. Having a sensitive provider who is aware of her trauma history can help a survivor feel safer and more comfortable. So preparing to ask about trauma also requires you and your colleagues to consider the safety of the interview environment. Is it physically comfortable? Does it provide privacy for the woman? Can you provide other cues to show your mom that you are working in a physically safe and supportive environment? Posters for domestic violence resources or support groups, for example, can signal that this is an environment dedicated to assisting trauma survivors. Emotional safety also matters. Have you taken the time to build a relationship with the woman before asking about trauma? Because abuse survivors have been hurt in relationships, they may have particular difficulty trusting people. You must make every effort to be your authentic self if you hope to receive honest, authentic responses from your client. Even in situations where contacts are very brief and time is limited, it's important to get a little conversation going to help the client feel more comfortable with you and the tasks ahead. So, let's imagine you've done your preparation. You've familiarized yourself with the screening tool, you've practiced its use, you've considered whatever of your own trauma reactions there might be, and you've taken steps to care for yourself around that. You've found a comfortable space with privacy and maybe some tissues, and you've established an initial relationship with your survivor mom. Your referral resources are close at hand. Now what? Well, first, it's important to share why you're asking. People deserve to know why you're asking about themselves and their traumatic exposures, and they need to know that they're not being singled out for this as well. For instance, you might say something along the lines of, this next set of questions asks about any trauma or adverse experiences that you might have had. Trauma is a very common occurrence and it may affect a person's health in a variety of ways. That's why we ask all our clients about their history of trauma. Explaining this in advance helps to normalize the questions. It may help address moms' fears that their trauma somehow sets them apart or is embarrassing or that they are less than as a result. And it shows that because you know about trauma and its effects that you're a competent person to share such information with. It's also important to let people know that they do not have to share anything they don't want to share, and that their responses are always completely voluntary. Survivors often choose to be selective about when and with whom to share their trauma history, based on whether or not they think that person is trustworthy and whether it's relevant to their care or current situation. And they may be especially wary of you based on previous experiences of being judged or discriminated against by care providers or others in positions of authority. Or they may just not want to go there today, and that's also a reasonable choice. Also, there are cultural and situational considerations that influence whether or not a person will share their history. For instance, someone who's grown up really steeped in adversity may not even recognize their experiences as traumatic. For her, it may be just life and how things go, because these are common experiences in her personal or community context. It's important to assure the survivor mom that the information they share will remain confidential to the fullest extent possible. But she must also be told that there are limits to confidentiality. For example, clinicians have a mandatory duty to report abuse or neglect of a child or a dependent adult. A survivor mom may know this, or at least be concerned about who you would share this information with. Understandably, they may fear being judged or experiencing other negative consequences if their information is revealed. Timing also matters. Make sure you're not rushing the questioning and are providing adequate time for the responses. It would be better to schedule another time to complete your assessment rather than rush through the process. A final and important consideration is the tone you set in the questioning. It's important to communicate empathy in both your spoken words and in your body language, and to maintain a non-judgmental stance, both toward the questions themselves and for any disclosures that might follow. More on that in the next video. Thank you for watching and listening.